Dr. Jason Lichten from Central Ohio Plastic Surgery. One of the most common things we talk about with patients when we talk about aging is the area around the eyes. They say the eyes are the window of the soul, but the eyes are often the first thing you notice on someone. And you'll see that an aged eye can give a tired, sad, angry appearance. And when we look at those areas, if it be upper eyelid skin hooding or emptiness under the eyes, a lot of times we'll address that with things like Botox and fillers to help camouflage those areas. But a lot of times we have to turn to surgery or want to turn to surgery. And so I want to talk about a blepharoplasty, which really just means correction of the skin of around the eyelid. And that can be done for both the upper eyelid, the lower eyelid, or both, or all four, I guess, if we're going to talk about both eyes. We'll start with the upper eyelid. So the upper eyelid, typically, obviously, Botox in the forehead or brow height to sort of lift this area up, helps rejuvenate that area. But if there's that extra skin that sits, that hoods, causes that heaviness of the upper eyelid, then surgery to remove that extra skin, tighten the loose muscles, or any areas of extra fat in through there can be done. This is a surgery typically we'll do in the operating room with patients asleep for comfort. We'll make a small incision that goes right in sort of the crease of shadow of the upper eyelid. And by removing that extra skin, gives a more awake, refreshed appearance. We sort of talk about creating a good eyeshadow space so it doesn't feel as though you're looking like you're tired all the time. The lower eyelid tends, as we age, when you get that sort of stretch of the skin in through here that makes things look sad and tired. Also, the fat that cushions your eye will sometimes puff out, giving those malar bags or under eye bags. Surgically, we sort of can lift, tighten the skin, take out extra skin, tighten the muscle, and any of that fat in that area can use either by removing or using it to help augment the cheek to soften that transition between the eye and the cheek to give you a more refreshed, younger appearance. Most of the time we talk about surgery and those results lasting for 10 years or more. Very common operation, easy operation, not very painful. Recovery tends to be very quick. Sometimes the biggest downside is maybe some black and blue and bruising that takes a couple weeks to go away, up to a couple weeks. But most patients are really happy having had that done and not having to come in and get injections over and over to have that refreshed appearance. For this and everything else, come to my website, ohioplastic.com, or call the office, come in. Look forward to helping take care of you.